All right, let's jump right in. Today, we're talking about Bell's palsy. It's the most common reason a person might suddenly wake up and find that one side of their face is completely paralyzed. It's a pretty terrifying experience, so let's break down exactly what it is, what's going on behind the scenes, and maybe most importantly, how we know it's not a stroke.
I mean, just think about that for a second. What would that be like? You go to the mirror to smile, and only half your face gets the message. It's this sudden, really jarring disconnect between your brain and your body. That's the reality for someone experiencing Bell's palsy.
And that's really the defining feature of Bell's palsy, the sheer speed of it. It feels like it comes out of absolutely nowhere.
So what does this actually look like? Well, you're seeing the classic signs right here. There's a droop at the corner of the mouth, you lose the wrinkles on one side of the forehead, and here's a really critical one, the inability to completely close that eye. We're not talking about a slow, gradual weakness. This is a big, abrupt event that just unfolds over a day or two.
Okay, so let's get into the official medical definition, because the key clues are right here. Acute just means it's sudden. Unilateral means it only hits one side. And idiopathic, that's a really important one. It's basically a fancy way of saying we don't know the single definitive cause, but we have a very, very strong suspect. And it all centers on the 7th cranial nerve, the one that's in charge of all your facial muscles.
So if we don't know the exact cause for sure, what's our best guess? Well, it seems to come down to one specific nerve getting completely hijacked. To really get what's going wrong, you have to appreciate this nerve's incredible journey. It starts at your brainstem and has to travel through this super narrow, bony tunnel inside your skull just to reach your face. And it's a real multitasker, this nerve. It doesn't just run your smile, it also handles taste for the front part of your tongue and tells your tear ducts and salivary glands when to get to work. So what sets all this off? Well, the leading theory, the main suspect, is a reactivation of the herpes simplex virus. Yeah, the same one that causes cold sores. The idea is that this virus, which has been lying dormant in your body, suddenly wakes up and decides to attack the facial nerve. Other things like diabetes, being pregnant, or even just having a bad cold can also up the risk. And this lays out the chain reaction perfectly. So the virus reactivates, and that makes the nerve get all inflamed and swollen. But remember that narrow, bony tunnel we talked about? There is literally no extra room in there. So as the nerve swells, it gets compressed, squeezed so tightly that the signals from the brain just can't get through anymore.
Just think of it like a garden hose that's been pinched shut. The water can't get through, right? It's the same idea here. The nerve gets pinched, and those electrical signals that tell your face to move, they're blocked. No signal means no movement. It's a pure and simple plumbing problem, a physical obstruction. Okay, now we're getting to the most critical part of this whole conversation. It's the first thing that would pop into anyone's head if this happened to them. How on earth do you know it isn't a stroke?
Well, the answer is actually pretty fascinating, and it all comes down to how your brain is wired. The diagram here is showing us the two main types of nerve damage. There's a stroke, which happens up in the brain, and then there's Bell's palsy, which happens out on the nerve itself. And the key difference between them? It's all in the forehead. Get this is the crucial difference. It's called the forehead test. You see, the upper part of your face, your forehead, actually gets nerve signals from both sides of your brain. It's got a backup system. So in a stroke that affects one side of the brain, the other side can still send signals down, which means you can still raise your eyebrows and wrinkle your forehead. But with Bell's palsy, the damage is to the nerve after all that wiring has come together. So the entire side of the face, forehead included, is paralyzed. No eyebrow raise. Okay, so even though the start of this is incredibly scary, the good news is that the outlook for Bell's palsy is generally really positive. So let's talk about how it's managed. You have to act fast. Getting on oral steroids like prednisone within the first 72 hours is the absolute best thing you can do. It helps reduce that nerve swelling and gives you the best shot at a full recovery. But, and this is just as important, you have to take care of that eye. Since the eyelid can't close, the eye can dry out and get seriously damaged. So using artificial tears during the day and patching the eye shut at night, it's completely non-negotiable. The journey back to normal usually follows a pretty predictable path. That first little flicker of movement often shows up within about 2 to 3 weeks. Then, over the next few months, things really start improving, with most people feeling pretty much back to normal within 3 to 6 months. So what does back to normal actually mean? We're talking about a complete recovery for 70 to 85% of people. I mean, all facial function returns totally. That is a fantastic prognosis. especially for something that starts off so frightening.
But what about that other 15 to 30%? Well, for a smaller group of people, the nerve healing can be incomplete, or it can get a little weird, leading to some long-term issues.
The main complication to know about is something called synkinesis. It's basically when the nerves get their wires crossed as they're regrowing. This could mean that when you try to smile, your eye closes without you telling it to. And of course, if that eye care isn't taken seriously, corneal ulcers are a huge risk. But maybe the absolute strangest example of this nerve miswiring is a phenomenon called crocodile tears. No, I'm not kidding. This is when the nerve fibers that are supposed to be telling your mouth to make saliva accidentally grow back into your tear gland instead. And the result? Every time you eat, you start crying from one eye. It's rare for sure, but an incredibly memorable complication.
And this really brings us right back to the most important takeaway of this whole explainer. Knowing how to tell the difference between a stroke and Bell's palsy just by looking at the forehead is absolutely critical. It helps patients calm down, and it helps doctors start the right treatment right away. So now you know. The next time you hear about someone with sudden facial weakness, you have this powerful piece of information. You know the key question to ask. Can you raise your eyebrows? That one simple question can make all the difference in the world. Stay curious.